Welcome to Gateway Today, the show that talks about all things Gateway Community Health Center. I'm your host, David Cash Vasquez, and today's episode of Gateway Today will cover many parts of Gateway Community Health Center. Part of that is health insurance and helping patients with insurance and helping patients without insurance get the proper medical, dental, and behavioral health coverage they deserve. That conversation kicks off with our Chief Medical Officer, Dr. Mary J. Cortez, who will touch on some of the important benefits that patients can receive whether they have insurance or don't have insurance here at Gateway Community Health Center. Then we head over to pharmacy to catch up with our Director of Pharmacy, Iracema Perez, who will highlight some of the important discounts patients can receive, plus the benefits patients can receive by using our pharmacy right here at Gateway Community Health Center. Then we're taking a trip to Zapata, Texas to catch up with our family nurse practitioner, Norma Guerra, who will highlight some of the different services patients can receive in our rural areas like Zapata and how they benefit by having a Gateway Community Health Center right in their backyard. We got a lot of show to cover on this episode of Gateway Today, so sit back, relax, kick your feet up, because another installment of Gateway Today starts now. Welcome to this installment of Gateway Today. Well, today's episode will cover many different topics, including health insurance and the important conversation patients need to know about when it comes to having health insurance and not having health insurance and the services they can receive no matter what. We kick that conversation off with our Chief Medical Officer, Dr. Mary J. Cortez. Check it out. Well, welcome to this installment of Gateway Today, and we are on the program with one of our favorite guests, our very own Chief Medical Officer, Dr. Mary Cortez. Doctora, thank you for being here. As always, a great sport. And the reason I like bringing you on the program, Doctora, is because you're a wealth of knowledge when it comes to all things Gateway Community Health Center. As our Chief Medical Officer, just really quickly, just as Chief Medical Officer, and that basically puts you on top of all the other doctors and providers that we have, right?
I supervise them and I oversee them, yes.
Yeah, you make sure that they're doing their job, right? So,
Yes.
and just because I want our viewers to understand sort of what that means for you, not only are you seeing patients, but you're also making sure that our physicians are...
that everybody's taking care of our patients, definitely.
So now that you understand what our Chief Medical Officer does and the important role that she plays, I did want to start talking about health insurance and the importance of what health insurance means to patients out there. And so I really wanted to ask, because I know a lot of folks think, oh, well, I have commercial insurance, I can't go to Gateway. Gateway's only for people that don't have insurance. We take regular commercial insurance, right?
We take care of everybody. So that's been the common knowledge before, right? And we have been trying to break that barrier. People thinking Gateway is only for the uninsured, but we have been doing a great job in your department making sure that everybody knows that we take care of commercial insurance, private insurance, Medicare, Medicaid, and of course the uninsured. So everybody is welcome to Gateway.
So Blue Cross, Aetna, Cigna, United Healthcare, all of these are insurance, commercial insurances that we take, right? And then I know we've also talked about Medicare, right? So Medicare for our older population, right? 65 and over, we accept Medicare as well, right?
Yes, Medicare, like plain or Advantage, we do take care of them.
In talking about Medicare, I want the folks with Medicare to understand also that because they have Medicare, they can also get a lot of their items, medical devices, wheelchairs, walkers, those are all covered under Medicare, right?
Yes, it should be covered under Medicare. And they need a visit and we determine if the patient will benefit from it. And then we give an order and then submit for approval through the insurance,
Awesome. So for our Medicare patients and those with Medicare, be confident that you can get all of the services and the prescriptions needed to deal with your day-to-day necessities. And then let's move on to Medicaid. So Medicaid for us would be our pediatric population, right?
Yeah, basically.
Our younger population, and we take Medicaid too, right?
Of course we do. Yes, definitely.
So anybody needing pediatric care can receive that from us here, right?
Mm-hmm.
Okay. So there we go. I mean, we're covering our private insurance, our Medicare, and our Medicaid patients. Now, also, I want to talk about our uninsured population. Anybody that doesn't have medical coverage is welcomed as well, right?
Yes, and definitely that's been the base of Gateway, right? Like to take care of the uninsured. We do a socioeconomic study, see where they land on the discounts for services, and we offer lab, medications, the visits, dental, podiatry, pharmacy, you name it. So we have availability for all of that.
So all the services covered for everyone with commercial coverage, and then those even without.
Correct.
Awesome. And that's really the reason why I wanted to bring you on, Doctora, is to really ask our authority, right, about these services, because as our services sort of grow, we're able to get these patients taken care of. I think the advice to anybody out there is there's no excuse to not get your health care in check. Is that a fair assessment?
Definitely. We're here available. We're the safety net for the community, right? Like we have multiple clinics around the city, multiple providers that are really qualified to take care of the patients. And people without insurance, it cannot be an excuse to be seen. And the patients with insurance should take advantage of that and be checked preventive, and then if they need more medical care, we will be able to give it to them.
So that's the great news. I think one of the other things that I want folks to really understand is that when there is a lapse in healthcare and when folks don't see the doctor, you as a physician in the trenches every single day dealing with patients, what is your concern for these patients when they don't come see you? What are you seeing that is of concern, and why people need to come early with or without insurance?
Yes. Well, what we want is to prevent complications from diseases, right? Like if you don't take care of your health, at the moment that you start feeling sick, it's probably too late, and the disease is advanced, and there's other complications, or kidney disease, eye disease, and like you name it, or like a visit to the hospital because you didn't take care of your health, and then it's so detrimental that you have to end up in the hospital and then come to us to continue the care.
Awesome. Well, I'm glad that you bring that up, because at the end of the day, Gateway is what our CEO calls us as a large doctor's office, right? So use Gateway to keep yourself out of the hospital, right? Preventative care at its finest. Is that what you would say?
Correct. Yes.
Keeping us out of the hospital is the way to go, and by you visiting Gateway, that's the way to do it. And finally, Doctora, I think the only other piece of advice that I'd like you to share with our patients and our viewers is how people can just start to become healthy again or take charge of their health. What do you feel is the easiest way to do that?
Diet and exercise, my favorite recommendation to all of my patients.
So no tortillas de harina, eh?
Well, and it's not like no tortillas de harina, right? It's just like have a balanced diet, a balanced lifestyle. Try to exercise as much as you can, sleep 8 hours, and that will get you a good start to a healthy life.
Everything in moderation, right?
Yes.
Yeah, love it. Well, the advice hasn't changed since I think when you started as a doctor, right, and started prescribing that to all your patients. It remains the same today. She's our chief medical officer. I'm glad that you're on the program. I'm glad that you're giving us insight into and that encouragement, right, to all patients to come and visit us. Whether you have insurance, you have coverage, you don't have coverage, there's no excuse to take charge of your health, take control of your health, and keep you out of the hospital, right? It starts with preventative care. So our Chief Medical Officer with words of wisdom for you today, her name is Dr. Mary J. Cortez, and she's on Gateway today. Thank you, Doctora.
Thank you.
Well, our thanks goes out to our Chief Medical Officer, Dr. Mary J. Cortez, a regular familiar face on our program who's always a wealth of knowledge, especially when it comes to letting us know what patients can expect, whether they have health insurance or don't have health insurance. Here at Gateway Community Health Center, we remind everybody that they are welcomed to our clinics, whether they have health coverage or don't have health coverage. We are here open for all of our patients. That said, we're headed over to pharmacy, another benefit that patients can take advantage of right here at Gateway Community Health Center, as we catch up with our pharmacist, Iracema Perez. Check it out. Well, welcome to this installment of Gateway today, and I thought it would be important that we continue this conversation about the services available to our patients here at Gateway, and no better person to bring in than our Director of Pharmacy, Ms. Iracema Perez, who is in the house with us today. Ms. Perez, thanks so much for being here. And, you know, I think one of the things we want folks to understand about our pharmacy is the availability of drugs, right? To make it real clear, we're a full-fledged pharmacy, right? And I wanted to ask you about that. Like, what types of drugs are available, medications for these patients that may have diabetes or hypertension? We have the medications to treat these patients, right?
Exactly. Good morning. Thanks for the invite, David. Definitely. So we do have a full-fledged pharmacy. We do service all of the different diagnoses that our providers within our clinic have. However, we also service, if our provider gives you a referral and that patient goes outside, they can also bring that prescription in and fill. So we have a formulary that is stated there, and a lot of our patients will fall under a scale and they qualify for a discounted price. But just because it's not on the formulary doesn't mean that the product is not available. So we do have a wholesaler with everything under the sun, and we can pretty much order the medication there. And, you know, depending on what that price is on that medication, then our patients qualify for a discount, because all of our medications are purchased under a 340B, a federal program that allows us to purchase our medications at a discount, and that enables us to pass that discount down to our patients.
Which is one of our advantages of being a federally qualified health center, which is the 340B program, right? And we could spend an entire show talking about how advantageous a 340B program is to us, but at the end of the day, it really just means that we pass these savings of these medications that tend to be in the thousands, hundreds, whatever, just really expensive medications, but we pass these savings onto the patient.
Exactly. That federal, the 340B program has really enabled us to offer those discounts really well to our patients.
So switching gears a little bit, I want to touch on the qualification, if you will, right? Any patient of Gateway can access our pharmacy, correct?
Right. We are able to service a registered patient from our clinic. So you do need to register with the clinic and qualify for the services.
And so as patients are visiting, because you know, we have multiple clinics around the city, around the Tri-Counties, Webb, Zapata, Jim Hogg, right? For the patients out there wondering, oh man, well, you only have a pharmacy at 2 locations, right? Our central clinic where we're at currently, and then our south clinic. But that doesn't stop us, right? We still able to deliver medications to these patients.
Right, you are correct, David. So we do have several clinics, but only the clinic located at 5015 Papas and the clinic located on Zapata Highway 2007 South Zapata Highway have an in-house pharmacy. However, our other clinics, which are, Hebronville, as you mentioned, Zapata, our newest clinic west, Shiloh, Laredo College. All of these, even our 2 pediatric North clinics, they have the ability to fax over a prescription. They do get faxed only to the central pharmacy here on 1515 Papas. So all of these prescriptions get faxed over to us and we fill them here. So any prescription that we receive by 4 o'clock on that day gets filled and then it will be sent out. So Zapata and Hebron do get their medications overnighted, and they receive that through an overnight carrier that we use. They arrive the next day at approximately 2 or 3 in the afternoon. Our local clinics, any of the other clinics, if they happen to send over a prescription, then we have one of our local personnel deliver that medication first thing in the morning to that particular clinic. The patient then is just, called and they go to their prospective clinic and they pick up the medications there.
Yeah, super cool because, again, for our viewers in Hebronville and our viewers in Zapata, I've had that question before, and they now have that ability just to go to our clinic and then the following day are able to pick up their medication, right?
Exactly.
And then for our local viewers here in Laredo, again, another convenience because many of our patients are not able to make that trip from our West Clinic or even our North Clinic or even our LC South Clinic. They just go to the clinic where they're comfortable going to and they receive the medication there, right?
Yes, they go to the clinic where they visited their provider who ordered that medication for them and they pick it up there.
Now, one of the last questions that I have for you, because we often get this question about insurance, and I have insurance, I can't use Gateway, or I can't be a patient of Gateway, or I don't have insurance and I can't go to Gateway. Like there's this misconception, but we accept everybody with insurance and without insurance.
Yeah, we do. We accept most of the major insurance companies. There might be a few like very large ones like Humana. We don't take that, but the majority of them we do. And we also have patients who have Medicaid, so we do accept the Medicaid. I'm so sorry, the Medicare.
Yes, Medicaid. Medicare, Medicaid. We also have for our veterans TRICARE as well, right? Yes. So these are some of the different insurances that we take, and they're able to access all of our services under one roof. And tell me about that. Tell me about the one-stop shop, right? I know it's select for some of our clinics, right? Not all of them have that one-stop shop, but let's talk about it here at Central because we are really avidly working on trying to do that for all of our clinics. But how is it special here at Central?
Right. It's really special the fact that you have an in-house pharmacy. Any clinic really that has an in-house pharmacy offers the advantage that you come in, you visit with your provider, and you just simply need to walk on over to your pharmacy and let them know, I was just here, they sent my prescription, and it's probably already being worked on, or they're able to access that prescription quite quickly and start working on that. So the fact that, it's all under one roof, you don't necessarily need to drive somewhere else or, call and make sure that it's ready. Right here, it's just a matter of walking over and letting them know we have access to the clinical portion. So if that prescription, they come in electronically, if it hasn't arrived into our pharmacy, we are able to see it and we know exactly where it is. We're able to locate it. Just the way our system works, we're able to see all the incoming scripts, and we can sort of speed that up, sort of like move it up to the line because the patient is here waiting. So we'll go ahead and speed that up and get it ready for you. So a couple of minutes wait and the medication will be ready.
And refills also by phone, right?
Yeah, so we have a 24/7 automatic line for the refills. And so even on the days that we are closed, the clinic may be closed, that system is still continuously working. A patient, all has to do is dial that number and they're going to put in the prescription number. It automatically goes into a system that we monitor 3 times during the day, morning, lunchtime, evening, before we leave, and we're continuously working those refills so that they'll be ready for the next day.
You're definitely on it, and I just tip my hat to everybody in pharmacy. If you ever get a chance to walk in, I've had the privilege to do that, and you walk into pharmacy, everybody is just laser focused on working. Just to give folks an idea and understanding really quickly, and this is the fun question, but how many prescriptions do you fill on average per day?
So our central clinic here fills about 500 scripts a day, and our Zapata clinic is filling about half of it. They're a bit half our size, about 250 a day. So it is a continuous work. Yeah, the team is amazing. Both all of our technicians, all of our pharmacists, they're super dedicated. And, it's not just a matter of also feeling, throughout the day, there's a lot of phone calls coming in. There's a lot of education. There's a lot of counseling. We are constantly having to demonstrate to our patients as well when they pick up medications that are injectables. We kind of have to do all the teaching as well. If they're picking up a glucose monitor, we're going to show them how to use that as well. So it's a continuous day, but it is a lot of fun and we love it, and we wouldn't have it any other way.
Well, I can tell you're having fun. Ladies and gentlemen, 750 scripts per day times 30, do the math. And you got Ms. Iracema Perez, Director of Pharmacy, not, kicking butt and not taking any names, man. Just really proud to work alongside you and your team and all the great things that you're doing in pharmacy. If you want to experience that level of exceptional care when it comes to your healthcare, please go over to gatewaychc.com to register to become a patient, or if you're an existing patient, consider using our pharmacy and visiting with Iracema and her team right here at Central Clinic. She's our Director of Pharmacy, Iracema Perez, on Gateway Today. Hey, our thanks goes out to Iracema Perez, our Director of Pharmacy right here at Gateway, for letting our patients know about all the different benefits they can receive by utilizing our pharmacy right here at Gateway Community Health Center. Well, we are about to take a break, but when we come back, we're headed over to Zapata, Texas with our family nurse practitioner, Norma Guerra. More Gateway Today on the way. Stay close.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome back to Gateway Today. Well, before the break, we said we were headed over to Zapata, Texas to catch up with our family nurse practitioner, Norma Guerra, who lets all of us know why having a clinic in our rural communities is super important to healthcare access. Check it out. All right, ladies and gentlemen, we are here at our Zapata clinic as we continue to visit our friends here at our Zapata clinic. I had to pull her away from patients, and we got her for a little chance to talk and chat about medical care here at our Zapata clinic. She is our family nurse practitioner, Ms. Norma Guerra, who is joining us on the program. Norma, thanks so much for being here. And, one of the things that I've noticed as we are kind of talking to everybody here at our Zapata clinic, Norma, is that everybody's a native of Zapata. Everybody seems to just have graduated from Zapata High School. Go Hawks, right?
Go Hawks, yes.
So tell me about that. Tell me about, what that means for the patients that come in here.
Well, for the community, yeah. We it's a very close-knit community. We know almost everybody knows everybody. And so it's actually a very wonderful thing, and we all get along. We know our families, we know our friends. It's
nothing like a familiar face, right? When you kind of see a physician and you want to, you're coming to look for care. You're coming to look for, a better healthy outcome.
Yes.
Talk to me about that. You're able to see pretty much any
from birth, age 0 to 100. The entire lifespan we can see, or I can, yes. Mm-hmm.
And so as these patients are coming in and we're inviting them to come into the Zapata clinic,
absolutely.
What are the types of things that you're seeing here in Zapata and from the surrounding areas?
So in our area, the most common issues are the diabetes, hypertension, hyperlipidemia. We have the whole thyroid. So we see a whole variety, and those would be chronic issues. We also have, our acute issues, your upper respiratories, your flus, your streps. So we see a whole, variety of conditions that come in.
Yeah, and I'm glad that you brought that up because, for folks that may be putting off their health care, a lot of times that's what we're trying to prevent, right? We're in the world of preventative medication.
Yes,
right?
Absolutely.
And I want the folks to understand that they need to attack it before it becomes something worse, right?
Perfect. Yes. Yes. That's actually the best way. It's better to prevent it, to know screenings coming in, annual checkups, do labs. Where are you at? Where are we at? Where can we go from here? And if there's nothing, if everything is perfect, then annual checkups. If we find something, then that's the best time to address it right then and there.
And, I'm glad that you brought that up, because when they come in, what is the type of process that the patient is going to see? They're going to obviously visit with you,
Correct.
but you can order lab screenings,
Yes.
Prescriptions.
If necessary, yes. Mhm.
Okay, awesome. So talk to me about prescription, because, being in Zapata and these rural areas, sometimes from the bigger cities, right, it's hard to get those medications, but Gateway gets
We
you.
have a pharmacy. Gateway offers the pharmacy here. We can order the medications through our pharmacy, and then they deliver it here. That's the first one. We also have 2 local pharmacies here as well. If patients choose or opt that route as well, we can do that. But yes, absolutely, we have our pharmacy with Gateway that we can utilize.
So for medical care, folks can know it's kind of that one-stop shop, right? I can come visit you, then go visit the dentist,
Yes.
then get my medications and my labs here.
Yes.
It's all in one place.
And the beauty of it is that we can see them here. We can refer to dental. If we have other needs, we also have nutritionists available through our Gateway in Laredo. Of course, you know that. And then our therapy, our behavioral health. So it's all together. It works wonderfully. Yes.
And for finally, Norma, for anybody out there that's sort of just putting off their health care, what's your advice to them?
My advice is be proactive. A lot of people are afraid to come in because they don't want to hear that they might have something, but don't be fearful. Be proactive. Come in, get it addressed, get it checked, and then together we can work to a common goal, which is better health outcomes for them.
Well, I appreciate your words, and I appreciate all the work that you're doing here.
I love
you're a familiar face, I'm sure, to a lot of folks watching right now.
Right.
And if you want to come visit Norma, make sure you do so right here at our Zapata clinic. Get to gatewaychc.com, book your visit right now, get in front and take care of your health with Norma and the rest of the crew here at our Zapata clinic.
Absolutely.
Hey, our thanks goes out to Norma Guerra, our family nurse practitioner, for providing high-quality healthcare to all of our residents across Zapata and the surrounding communities, and for keeping it real when it comes to her roots in Zapata County. That said, that's going to do it for us on today's episode of Gateway Today. But remember, if you want to become a patient of Gateway, head over to our website, gatewaychc.com, to register to become a patient, or call 956-795-8100 to experience high-quality healthcare provided for everyone. Remember, Gateway turns no one away, whether you have insurance or don't have insurance. Gateway is available to everyone. If you want to catch a full rewind of this episode or any of our other Gateway Today episodes, make sure you head over to our YouTube channel, search Gateway Community Health Center, and don't forget to smash that subscribe button. Till next time, we thank you for watching this installment of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.